Okay. Welcome to the 12th Quadrennial WFNN Congress, and I want to introduce our next speaker, who is Aschwinn Van Loon from the Netherlands. He's going to speak about humor as a nursing intervention. Please join me in welcoming Aschwinn.
Well, since it's my first slide, does everybody get the hint? I see nobody smiling yet. Oh, there come the smiles. Did you get the hint or not? What's the patient? Oh, yes or no? Did you get the hint? I think he's dead. At least that's what I'm thinking. Forward. Okay, let's start about what's laughing. Laughing is, according to the Oxford Dictionary, to make a spontaneous sound and movement of the face and body that are instinctive expressions of the lively amusement of sometimes also duration. It's a given expression of realization of happiness. That's a long one. Laughing is also a physical reaction to emotion. So if you start to cry, you can also start to laugh. So, how does laughing start? First, the corner of your mouth will slowly curl. Then, the muscles of the eyes will participate. And then, a noise, a bit of a growl, will start to follow. And then, as it goes along, it goes bigger and bigger and bigger. The chest will start to go more exhaling and inhaling. And then, at the peak of it, you eventually have to sit down because your muscle will get so weak. And if it goes weaker, you even have to pee. So that's what laughing does to you eventually. So there are many kinds of laughter. The infectious laughter, the arrogant laughter, the liberating laughter, the compulsive laughter, the mean and false laughter, the giggles, the scream laughter, the cordial laughter, the laughing kick, and the burst of laughter. And you can imagine what they will do to you. Excuse me. But there are also several theories about laughter. The first one is the superiority theory. Let's have a wait then. People are coming in. I'm not starting over, so. So, well, the last one was born in the church. She leaves the door open. More people. Yeah. Wow. Well, let's go further then. The superiority theory is from Plato, and I have to read this because it's a lot of text. Plato was convinced that laughing had much to do with the bad side of humankind, whether a person laughs or at misfortune of others. Laughing comes forth out of the ignorance about oneself. The person laughing thinks himself richer than the other one, handsomer, much more upright or wiser than he in reality is. The laughter is directed at the inadequacy of the other person. He went on to say that humankind has to be careful that one doesn't laugh too much. Too much laughter can make one superficial when dealing with more important things of life. Then we have the incongruity theory. The Britannica states that humor is a perceiving of situation that to self-consistent, but mutual incomplete of frames, reference, and associated context. Humor is a form of communication in which a complex mental stimulus illuminates or amuses, or excites or reflects of laughter. This definition of humor is described as the theory of incongruity. it's the best way to explain with a little example. For instance, there was a girl who had a dream, and she was telling her dream to her neighbor. She was dreaming she was visiting God, and there were two doors. One door, small door, and one big door. And she opens the small door, and there's a lot of music starting. And then she starts opening the second door, the big door, and she pushes, and finally she pushes it open. And then they went, what did God say? It sticks, doesn't it? That's the best way to example that one. Then we have the Bergson theory. It's much used for clowns. Clowns use them because they do something and then something ridiculous happens. When someone is running across the street and he suddenly trips or falls down, there's a good chance that many of us will laugh. But if you turn it around and you know that he's going to fall, are you still laughing then? That's what the Bergman theory says. Then the last one, Jefferson theory. Every theory tries to give a convincing answer to the question of human reality itself. Gail Jefferson is contrary to this. This is because it only occupies itself with the question of how laughter interacts with the conversation of what function it might have. According to Jefferson, laughing is an activity whereby one participant invites the other participant to start laughing with him. This invitation can be accepted or declined by the other one. But all four theories have three common goals: the form, the message, and the effect. So, what is humor exactly? Let's turn my page. According to the Oxford Dictionary, humor is a quality of being amusing or comic, especially expressed in literary speech, a mood, or state of mind. The Dutch Dictionary says humor is an eye and a sense of cheerfulness, contradictive expressions. Sigmund Freud, we all know that one. Humor is a way to relieve oneself too much energy and tension, and it's a rare and precious gift. Pascali, humor is a communication means to strengthen mutual relationships. And McCluskey and Bulacek, I think everybody knows that. You can read it. But according to me, humor is the short social distance between two persons. So, well, what's an ordinary nursing intervention? It's going to be a long one. According to Nijssen van Sluis, this is a Dutch book which we use as nurses. Every direct form of healthcare on behalf of the patient by a nurse. And then you can use your own professional knowledge. It's either generic or specific. For instance, we all know what we have to do when a patient is low blood pressure, but when the ICP pressure is high, that's specific. Using your practical skills or use one's own intuition. My humor is totally different than anybody else in this room. Using scientific nursing research. That's explained once themselves. Then, styles of humor. You've got lots of styles: upside down, absurd humor, double meaning, grim humor, sick humor. A pun, inside jokes, present humor, mockery, a surprising turn of humor. For instance, in an inside joke, the doctor is being called urgently away, and he says to the patient, "Don't get well." But the most important part of what you have to do and don't do, that's the most important ones. First of all, the do's. Here we go. Your profession is always number one. Be professional. Humor comes later. Determine if the patient is receptive to humor. So if he isn't receptive to humor, don't use it, because you will go down to a sinking ship very, very fast. I speak that from first hand. I will explain that one. Once I got a patient over from ICU unit to the normal ward, and the husband was standing and springing around, and he said, "Well, take care. She isn't here for her sweaty feet. Well, that will terribly wrong. I can tell you that. Determine how the patient reacts to humor. If he smiles, or just starts to laugh very hard, or just react with a small smile. Always pay attention to the reaction of the patient. That goes with the first one. And always be alert on the negative side of the humor. For instance, that I gave, he's not for his sweaty feet. Well, go back then. Turn around and burn very fast. Second part of the do's. Collect humorous situations and materials. For instance, when I walk around in my hospital, I always wear a pair of yellow shoes or a t-shirt under my uniform, and then people will stop, oh, what's underneath that? And you can show them. Very simple things. Humor should be used as a means, not as a goal, but as a mean. Encourage fun and playfulness, because if the ward has an open setting, humor will come, and people will react to that. And then the don'ts. Don't offend patients, because it will get back to you. And don't try to use your humor, because my humor is totally different than everybody else. Because I've grown up in Holland with British humor and lots of other comedians, but in the US, my humor isn't there, probably, because my British humor is not American humor. Same as here in Croatia, there's different humor. But also try to find out what the patient wants. Don't make any jokes about sensitive subjects. Especially in America, I think sex is off topic. In Holland, you can do that. Don't use it around a patient with a cognitive disability. For our neuroscience nurses, that's a bit of a hassle, because most patients have a deficit. But, for instance, don't use it with Down syndrome, because they have a totally different view of humor. Humor must not predominate. Stay away from black humor and ethnic jokes. You can do that indoors with the doors closed as nurses on the wing, but don't do it with patients, because you might offend them. As I said, humor should not be used as a goal, and don't be a clown. Especially if you are being a clown, then they will say, oh, there's the clown going by. And then it's text with the do's. Be professional. Almost done. Questions? That was a short one.
Anyone have questions? I actually have a question. I am not very good at using humor. And I think that I come across as undereducated instead of being funny. And so I'm very curious, how do you bridge that being able to lighten things and make a joke without seeming unprofessional?
First, by being yourself.
Yes.
If you aren't yourself, you can't express humor. And the best thing is try to see what the patient wants, what kind of humor he or she likes, and try to twist and turn yourself with your jokes. That might work. Try it. But don't use it at the first 5 minutes when you are with the patient. Wait a day or two. Get to know each other. And then try to use it. Question? Was that answer?
Yeah,
okay.
Great advice.
I tend to avoid jokes as such, because I feel there's a binary situation at the end. They get it or they don't, and it can go really fast. Yeah. But whereas I feel humour, when you say you're not good at it, but it's about being light, and you do that. And And that way they can take it or leave it. It hasn't all suddenly gone flat.
No, if you don't have the ability to use humor, don't use it, because then it will be forced. And forced humor is always wrong. It's always wrong. Try to it's fine. You're walking on a very thin line. It either is good or it's bad. There's nothing in between. So it's finding the right opening, the right time, the right spot, be on the right side, and just throw it in. See what happens. And you can always apologize. You can always apologize. So, you had a question.
I was going to say what you were going to say is you can always apologize. I have a coworker, I would have never done this. She said, I don't know what came over me, but she had a little gentleman, very elderly, and she was helping him to toilet, and for some reason she didn't know what came over her. They had a very light, they've been joking, and she smacked the bottom. And he was so offended. And she said, all I could do was apologize.
Yeah.
Abjectly. And then they were fine.
Yes.
She said, I'm so sorry, I don't know what came over me.
But that's a situation you want to collect. Collect them, write them down, and use those situations for other persons. Let them read them. For instance, in Holland we've got a joke, and you can't translate it, but it comes down to everybody's lying. The neurologist, if you translate it, neuroloog, it's lying in the end. Radiology, radioloog, lying at the end. So who can we trust? That's a small joke in Holland, which I can tell. You can't, because you have to translate it. But you can also try and collect funny things, what people say. For instance, once I had a guy, he said, I've got a shoulder pain because of my painkillers. But he meant I needed painkillers for my shoulder pain. Yeah? You turn it around. Collect them. Be funny.
And it fits so well with Joanne's talk this morning about the joy of nursing too. And the thing is, we're not always using it with our patients. If we're using it amongst ourselves, I had a surgeon that I worked with very closely who constantly in ward rounds recited Monty Python's Flying Circus. And there was always a comment, and there was always something reminding us of somebody. And we found the joy in each other, not necessarily with our patients, but keeping ourselves buoyed along. And I think that's really important nowadays. Sometimes we're so serious at work, and we're encouraged to be serious, and the fun is gone, and we need to bring it back. It's really important.
Absolutely. And if my favorite physician is Patch Adams. Yes. Have you seen the movie?
Yeah.
And as he stated, you treat a person, you treat a disease, you win or lose. You treat a person, you always win. Same with humor. If you can use it, you're always winning. Any more questions? I still have time. Still got 10 minutes.
Yeah. Well, on that note, I'm going to tell you a very funny story talking about Patch Adams. I managed a pediatric neuroscience unit many years ago in Edinburgh. And I heard this, what I'm going to say, a flicker of a noise. And I walked in, and there was 2 clown doctors in there. And of course, as I walked in, it was like quiet time. But it was their first day, and they'd come in and they caused all this ruckus. And I said, excuse me. And the children were kind of like this, because I had that look. And the clown doctor put his head down, he looked at me. And I said to him, a word in my office, like this, you see. And he came in and he explained, what he was doing. The end of the story is, I married him.
See, humor wins every time. Any more questions? No? Then I put on my last slide. And I'm trying to collect more data, so please take a look at the website, which I've made, because when I was searching the web for my thesis, I could find bits and pieces everywhere, and I'm trying to collect them on my own website.
Thank you so much for a lovely lecture.
You're welcome.
You'll all go to this website and participate. That's how we encourage nursing research and our better understanding. So thank you so much, Aschwinn.
And if you don't want to write it down, just pick up the card.